Thank you for joining us for Ask a Therapist, the Blue Cross Blue Shield of South Carolina series, in which we speak with mental health professionals about issues many people face every day. I'm one of your hosts, Brindy McNair, and today we're joined by Prisma Health psychiatrist Dr. Ashley Blackmon Jones to talk about maternal mental health. Thank you for joining us. What are some mental health challenges that are unique to mothers?
That's a good question because I believe mothers face many unique challenges. Many of the challenges are related to, I think, the stigma of obtaining treatment if they are struggling or talking to others about that, increased responsibilities and demands on their time, access to care or specialists with expertise with women's related issues, fears of losing their children if they do seek treatment, and policies that don't really support women. I also see women experiencing infertility as well as pregnancy and infant loss or struggles with breastfeeding. So I think there are many unique challenges women face, and it's so important for them to be able to be supported.
You touched on postpartum depression, which I think is something that many people have heard of, but are there other perinatal mood disorders that women have to deal with?
Absolutely. Actually, that's one of the most important topics that I spend a lot of time talking about during my seminars or presentations with other people is I'm glad that people have heard of postpartum depression and are paying attention to it, but really we don't want to ignore all the other illnesses that can happen in pregnancy or postpartum. Any psychiatric illness can be present, and it's important to understand and monitor for all of them. So that includes anxiety, obsessive compulsive disorder, post-traumatic stress disorder, schizophrenia, bipolar, substance use disorders, all of them can be present. So talking about them, screening for them, and assessing for them is really important.
Are there certain populations who are more at risk or who are disproportionately affected by maternal health issues?
So there's not a way to really predict who will develop a psychiatric illness during pregnancy or postpartum. However, there are potential risk factors that can make someone more vulnerable, like partner relationship issues, poor support, a history of mental illness or substance use. Depression during pregnancy actually seems to be one of the highest risks, with a reported threefold increased risk for development of postpartum depression. Data has shown racial disparities related to access to care, mortality, and screening for depression. So I think increased awareness, identifying areas for change, and developing effective interventions to address healthcare disparities when it comes to psychiatric illness and maternal and infant mortality is really critical.
So, are there times during pregnancy or after childbirth when perinatal mood disorders tend to manifest?
They really perinatal psychiatric illnesses can really present at any time in the perinatal time period. Mothers can have an existing illness, or the illness could present for the first time, since the majority of mental illnesses present during reproductive ages. As with any chronic illness, the symptoms can fluctuate and get better or worse throughout the course. I encourage people to think of psychiatric illnesses just like any other illness they may have, diabetes or high blood pressure. And I also encourage monitoring throughout the pregnancy, since I often see people who have been diagnosed with postpartum depression, but the depression actually began during their pregnancy. In the postpartum time period, there are a high percentage of women that experience mood shifts after delivery, so monitoring is especially important during the first few months. The most common mood change is what we call the baby blues, and this is typically self-limited and a time within the first 2 weeks of heightened emotionality with some anxiety and mood shifts and irritability and tearfulness. And usually that sort of goes away on its own. But we do monitor closely for the development of postpartum depression, which we see in about 10% of women, and it will have symptoms that we would normally see with a major depressive disorder episode. We also monitor for postpartum psychosis, which occurs in about 1 to 2 out of 1,000 women, but it is a psychiatric emergency and something that we would consider a crisis.
So, how can someone recognize if they might be affected by some of these mental health issues or disorder?
Learning to pay attention to changes in thinking and emotions that occur are an important part of what we call self monitoring. So, I recommend that mothers or supportive persons that they have in their life look for symptoms of any psychiatric illness, which would include changes in sleep, not due to the baby, like trouble falling asleep or staying asleep or not needing as much sleep, changes in appetite, a decrease in the usual level of interest or activity, a decline in their ability to feel relaxed or to enjoy activities, feeling down or depressed, trouble with concentration, changes in energy, unusual behaviors that are out of the ordinary or concerning for others. It's important to also monitor for thoughts of no longer wanting to be alive or suicidal thoughts or thoughts of harming themselves. One other symptom that we see sometimes that's a little bit unique to perinatal psychiatry is called intrusive thoughts. Some other illnesses have it, but in the perinatal population, we see them as these sudden unwanted thoughts or images that pop into the mother's head about harm coming to the baby or even her causing harm to the baby. They're significantly distressing for a mother. And so we usually ask about those as well, because that can be kind of unique to that perinatal time period.
Yeah, that's terrifying.
Yeah, and we sort of see that change, and I think, they say basically almost 100% of people will have some sort of intrusive thought after they have a baby, and it could just be a 1 or 2 time sort of distressing thought, but sometimes they get really sort of stuck in there, and we notice that they change if people have had them before, that it changes to be more about the baby than they would have had before they were pregnant or postpartum.
Oh, okay. Is there anything a pregnant person can do to prepare for this, in addition to everything you have to do to prepare for a child coming? Is there something you can do, like, as far as making a mental health care plan?
I think having support and access to a care team is important. Support comes in a variety of ways. So I encourage moms to have a social support system and some sort of social connectedness, and then also consider psychotherapy for additional support and help in management of their stressors and relationship changes. We see a lot of role transitions with having a baby. For instance, someone going from a working person to a not working person, not a mom to a mom, and even just navigating the role of who does what domestic chore at home with a partner changes. Studies have actually shown that both cognitive behavioral therapy and interpersonal therapy have been helpful, especially with postpartum depression. So I encourage mothers to engage in every week or every other week psychotherapy in order to get the most effective treatment. I also recommend making a plan for sleep or to see if it's possible to arrange help in caring for the baby at certain times so that she can attempt to rest. We know that disruptions in sleep architecture can worsen psychiatric illness, so we try to plan ahead for that. I also take a non-judgmental approach in their plan for after delivery if they're going to breastfeed or not breastfeed and try to talk through some of those decisions ahead of time so that it doesn't feel so stressful in the moment after they've delivered.
Thank you so much for joining us today, Dr. Jones. This is great information for moms who may be struggling with their mental health. We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can call the number on the back of their insurance card for mental health resources. We hope you'll join us again for our next Ask a Therapist discussion.